Imagine that you are a psychologist, and Maria comes to see you. Just looking at her, you can't tell what's wrong with her or why she has come to your office. What do? Well, you probably answered, I talked to her, of course. Talking to Maria is a good first step in figuring out what's wrong and how to treat her. A clinical interview is a dialogue between psychologist and patient that is designed to help the psychologist diagnose and plan treatment for the patient. It is often called a conversation with a purpose. What's the difference between you, as a psychologist, talking to Maria and her best friend talking to her? There are several key differences in a normal conversation and a clinical interview. First of all, a clinical interview has a focused purpose to diagnose Maria. If she is just talking to her best friend, the conversation doesn't have a focus and could wander around to any topic. Second, in a clinical interview, the roles are clearly defined. You are the psychologist and Maria is the patient. As such, you might ask more questions, and the interview is really only about Maria. In contrast, when Maria talks to her best friend, they probably both ask questions, and they might talk about her friend's troubles too. Finally, a clinical interview occurs within a defined time frame. When Maria talks to her best friend, they can start in their conversation whenever they want. But with her psychologist, she knows that the appointment is for Tuesday from 2 to 3 in the afternoon. Let's look closer at the types of clinical interviews, as well as how to conduct a clinical interview and the benefits and limitations of them. Again, imagine that you are a psychologist. How might your clinical interview be different from Maria, a first-time patient, and Sarah, a long-term patient that you've had for years? How might it be different from Maria, who doesn't appear to have anything wrong with her, and Bridget, a patient who is forced to come see you because she keeps talking to trees and other inanimate objects? There are many types of clinical interviews that can be used at different times and with different people. Let's look at two of the most common clinical interviews, the intake interview and the mental status exam. The intake interview happens the first time someone comes to see you. This is the interview where you, as the psychologist, ask what brings them to you, what their mental and physical health history is, and what they would like to get out of their time with you. When you talk to Maria, for example, you might start by asking why she has come to see you. She says that even though everyone else sees her and thinks she's fine, she feels like a mess. She's stressed out all the time and has been experiencing panic attacks. You might then go on to ask questions about when the panic attack started and ask her to elaborate on her life and problems. Remember Bridget, the woman who talks to trees? Unlike Maria, Bridget appears to have something wrong with her from the get-go. Not only that, but when you begin to talk to her, you realize that she's not answering your questions in a logical way. She's making no sense whatsoever. A mental status exam is a clinical interview that looks at more than just the answers to your questions. You can look at a patient's behaviors, appearance, attitude, and movements, as well as their answers to your questions. All of these things will give you a good view of what their mental health is like. Of course, a mental status exam can be used on any patient, including those who seem lucid, like Maria, but it is often used on patients who are not able to talk clearly about their problems. Whether you're doing an intake interview, a mental status exam, or one of many other types of clinical interviews, there are several elements that are important. First of all, psychologists conducting clinical interviews need to offer a safe space for discussion. The client needs to be in a non-judgmental space in order to open up. In addition, reminding a patient that you will